Samuel has a great head of hair, does not have any male pattern loss at all. Unfortunately, as a younger child, he sustained a burn to this area of his scalp. And in total, it probably is about, if you do the math, it's probably about 54 or 55 square centimeters of area. It lends itself very well to transplantation. He's got very good blood flow here. He's got great capillary refill. But this is an example of a patient who's really kind of custom made for a specialized follicular unit extraction case. We've had this in the works for a while, the planning of this procedure, a pretty complex surgery where we're looking to be able to fill that area in exclusively with follicular units, doing one by one follicular unit extraction. I consider it a complex case because you have to make a choice if you want to do a linear excision or follicular unit extraction. And in his case, because of the scarring he has, it lends itself much better to follicular unit extraction, so you don't create any more scarring in the area where he's already got a burn scar. For this particular case, I'm going to use what's called the Vortex, and it's a handheld FUE device that I like. I have a good feel for it, and with the depth of his hair, it's something that I want to have control of manually to make the changes that we want to make. So we're going to go through, and our first step is going to be to numb up the area and get him nice and comfortable, and we'll be providing anesthesia throughout the entire zone. And then I'm going to start my harvest, and after I finish the harvest, then I'll start making the recipient incisions, and meanwhile the girls will be trimming the grafts even nicer and getting them ready. For something like this, you want a surgeon or somebody who obviously does nothing but hair transplant. This is not something that should be attempted by a part-time surgeon or somebody who just does hair transplant on the side to make a little extra money. This is life-changing for him, and this is something we have to do right the first time. What we're trying to do with FUE is we're trying to get past a certain level in the skin, but without going so low that we tear up the follicle. So with this instrument, I can adjust that on the fly. Once I've determined that I've got the right depth, then I can sort of start going through and going a little bit faster and work in zones. And as I make the passes, then I'll come back and we'll extract the grafts. When you're transplanting into a scar, any scar, you have to use a little bit of discernment when going about it. There's a few things you have to do a little bit different. Number one, you have to make sure that with that scar, whether it be from a thermal injury or radiation, and I've seen both, they behave differently. The most important thing is you've got to make sure that there's adequate blood supply. You've got to make sure there's adequate capillary refill when you press on the tissue and it doesn't stay blanched for too long. Because obviously the main reason the grafts won't survive is you could not have adequate blood supply to the scar area. I'd say in my experience though, that is not the case, even with some of the worst scars I've seen. Usually even the bad scars will have adequate blood supply to support the growth of follicular unit transplantation. The hair will grow splendidly. We got beautiful coverage in that area. And I very much look forward to him in 10 to 12 months when he comes in with that big smile on his face, because we've completely covered the scar up with hair.